A doctor is making one of our Newsom's house calls this morning right here in the studio, and not just any doctor. We have Jamie Wagner, who is a breast cancer surgeon at the University of Kansas Hospital. And Jamie, so often women who are diagnosed with breast cancer sometimes believe that they're going to have their breast removed. Is that a misconception?
It is a misconception. Actually, we have now really expanded the opportunity for women to preserve their breast. Breast conserving therapy with a lumpectomy combined with radiation really is no difference in survival or the risk of recurrence than having a mastectomy.
How do we choose a surgeon? Are there certain things we need to look for? Should we get a second opinion?
I think a second opinion is always good, especially if you just are not comfortable. Your surgeon is kind of like a marriage. You need to have full confidence and be very comfortable with that surgeon. Something that is very important, I think, to look for is the credentialing of that surgeon, to make sure that fellowship training within the field of breast surgical oncology and that their practice really focuses on the breast field.
What are some things that we should avoid when we're choosing, a doctor? Are there certain things that we need to look at and say, no, maybe that's a red flag, I need to walk away?
Really looking at, I think, what their practice consists of. If their practice is really focused, a good portion of their practice is focused on breast surgery, I think that it would definitely be somebody that you can have confidence in. But if they dabble in it, it's very difficult to stay up with what is going on with breast cancer, new technology, the data, what we should be offering patients to give them the best outcome. And to do that on the side, it's impossible.
What about reconstruction? Because that's a huge thing. For those women who do have to have their breasts removed or choose to as a preventive measure, how does that whole process begin? It's not just one and done, one step, you're in and out.
You're right. From a reconstructive standpoint, phase one of reconstruction can, the vast majority of the time, be done at the time of mastectomy. But to complete the entire process, it's at least a 2 to 3 phase procedure. So you need to, I think, have realistic expectations when going into it. But again, finding a plastic surgeon who couples with that breast surgeon on a routine basis is going to give you the best outcome. When
you're doing surgery, what is in your mind about that woman and saving her breast and just the sense of that self for that person?
Right. It actually starts at the first time that I meet that woman in clinic, because breast cancer, as you understand, is a very psychosocial disease process. And so really treating the whole woman and giving them the right surgery and